Okay. All right. Hello, everyone. My name is Amy Dishroon. I'm a performance improvement coach at the American Hospital Association. I'm so excited to see you all on today for this webinar. Really excited to be talking about this topic right around lunchtime. So talking about food today, and as a non-clinician, but a public health professional, this is a topic that I'm really interested to learn with all of you about today. We have today's sponsored webinar titled A Clinical and Culinary Guide to Healthy Hospital Food. And we're extremely honored to have the Physicians Committee for Responsible Medicine, or PCRM for short, sponsor and lead this presentation and discussion today. They've been a great partner for the AHA, and we appreciate their leadership and work that they've done in this important area. Before we get started, just a few rules of engagement to highlight. So you can access audio by listening in through your computer speakers or through your phone. Please note you are in a listen-only mode. If you're having any issues, you should be able to access the toolbar at the bottom of your screen to switch to either phone, audio, or computer audio. This webinar is being recorded, and we will make this available on our website. Please note that all the participants on the webinar can view the chat, but it will not be included in the recording. We shared the slides by email prior to this webinar, and they will also be available for download in the chat. So throughout the webinar, if you have any questions for our speakers, please enter them in the Q&A pod, which you can find at the bottom of your screen on your Zoom toolbar. I will be moderating a Q&A session at the end with our speakers. So if you have any technical questions or comments in general, please use the chat. And finally, after our webinar is over today, we will have an evaluation that will pop up on your browser. And we really value your feedback, so we encourage you to just take a few moments to complete that. So today I am honored to be joined by two fantastic speakers. We have joining us today Dr. Anna Herby. Dr. Herby is the Nutrition Education Specialist for the Physicians Committee for Responsible Medicine, a Washington, D.C. based nonprofit organization dedicated to promoting preventive medicine, especially better nutrition and higher standards in research. She is a registered dietitian and certified diabetes educator with a doctorate in health sciences. Dr. Herby manages education programs and resources for the Physicians Committee and works to help hospitals improve patient menus. Prior to joining the Physicians Committee, she worked as a clinical dietitian and Food for Life instructor at Adventist Health Howard Memorial Hospital in Willits, California, where she helps both inpatients and outpatients make lasting dietary changes. We also have Dustin Harder, who is the host and creator of the original vegan travel series, The Vegan Roadie, and hosts the weekly podcast, Keep On Cookin'. He is also an award-winning cookbook author, and his current release, The Power Foods Diet, is a collaboration with Dr. Neil Barnard and was the publisher's weekly bestseller. Chef Dustin has appeared on several news and media outlets and competed in a Food Network, and he currently serves as the culinary specialist with Dr. Herby with the Physicians Committee for Responsible Medicine in an effort to implement healthier meals in hospitals and university settings. All right. Well, Dustin and Dr. Herby, thank you so much for being here today. I will hand it over to you to begin.
Thank you, Amy. It's so good to be here with you all today. And so today we're going to talk about healthy meals for inpatients. And just to start off, I just want to say the word healthy can be pretty vague. So I wanted to start by providing a little bit of a definition. So based on the overall balance of nutrition science, we can distill a healthy diet into a few key food groups and nutrients. So healthy, we're going to define it by a diet that's really high in fruits, vegetables, whole grains, legumes, and nuts. And then it's going to be lower in processed foods, animal products, refined sugars, and salt. So this is a great way to eat, not only to ensure that your nutrient needs are met, but also to protect against non-communicable diseases like heart disease, diabetes, stroke, and cancer, also to reduce risk of obesity. All of these we're really seeing a lot of in our healthcare facilities. So I'll start by talking briefly about some of the most impactful large-scale studies on nutrition and chronic disease. So since heart disease is the number one cause of death for Americans, let's look at diet's impact on cholesterol. Population studies show us that the more plant-based a person's diet is, the lower their overall cholesterol. So this research here is from the European Prospective Investigation into Cancer and Nutrition called the EPIC study. It's one of the largest cohort studies in the world with more than 500,000 participants. They were recruited across 10 European countries and followed for almost 15 years. So data from that study shows in a stepwise fashion, the more plant-based the diet, the lower the total cholesterol. With those people eating a vegan diet, they're having the lowest cholesterol than any other group. Similarly to that, we have data from the Adventist Health Study too. And this also showed the more plants you have in your overall diet, the lower your risk of type 2 diabetes. So this study looked at nearly 61,000 people for about 4 years. They looked at food frequency, questionnaires, and health outcomes. The researchers found that the incidence of diabetes was only 2.9% in those people consuming a vegan diet, compared to 7.6% in the omnivores. And the researchers, they adjusted for age, for sex, ethnicity, education, income, physical activity, all of that good stuff, including TV watching, sleep habits, alcohol use. So in addition to diabetes being the lowest risk for vegans, it turns out the vegans were the only group within these subcategories to have a BMI in that healthy range as well. So those were population studies. Then what happens when those who already have diabetes make a diet change? This clinical trial was conducted by the Physicians Committee. The study included 99 adults with type 2 diabetes. The participants were randomly assigned to follow either a low-fat vegan diet or a diet following the current American Diabetes Association guidelines. So that includes carb counting and then reducing calories if you're overweight. After 22 weeks on these diets, the A1C had fallen by 1 full point for the vegan group, which is nearly twice as much as it fell for the ADA group. Participants in both groups reduced their medication needs. So looking at those whose medications were kept stable, the A1C dropped by 1.2 points for those in the vegan group, and this is compared to only 0.4 in the ADA group. So not only did A1C go down, weight and cholesterol went down too. Weight loss averaged about 13 pounds in the vegan group compared to 9 pounds in the ADA group. LDL dropped by 21% in the vegan group compared to 9% in the ADA group. In Dean Ornish's famous lifestyle heart trial, 48 participants with moderate to severe heart disease were randomly assigned to an intensive lifestyle change, or they were in the usual care group. So those in the lifestyle group, they were instructed on exercising regularly, following a low-fat plant-based diet. They were told to quit smoking and given resources to help manage stress. And by the time that 5-year follow-up period was complete, we had some really great results. So these were the outcomes of those in the lifestyle intervention group. There was a significant drop in cholesterol and LDL and weight. The control group experienced about twice as many cardiac events than the intervention group, and regression of coronary atherosclerosis was happening in those who were following the lifestyle changes, meaning that heart disease was being reversed. Dr. Esselstyn conducted a similar intervention with actually a larger group of patients. So 198 people with heart disease were counseled on following a low-fat plant-based diet, and they completely eliminated dairy, fish, meat, and added oil. 89% of those patients stayed adherent to the diet, so that's 177 people. And out of those people, there was only 1 stroke. Compare that to those who fell off the wagon. That was about 21 people. And out of those people, 13 cardiovascular events were reported. And let's look at the angiogram. Here you can see the left anterior descending artery is opening back up. So photo A is from the beginning, before any diet changes, and photo B is after that intervention, after 32 months. It shows that the atherosclerosis is essentially being reversed. The arteries are opening back up. And this is without the use of medications. So it just goes to show how powerful diet can really be as a tool to manage chronic diseases like heart disease. So in terms of nutrients and building a healthy hospital meal, what does this all point to? So essentially, when we're looking at hospital food, we want the meals to be high in fiber. We want them to be low in cholesterol and in saturated fat. We want them to provide as many nutrients per bite as possible. And then, of course, they should be focused around a diet that's just been shown over and over again to reduce risk of chronic disease, and in some cases, even reverse it. So it just so happens that a plant-based diet, which is focused around fruits, vegetables, whole grains, and legumes, checks all of these boxes. So that's what we're going to be talking about today. Now, as a dietitian, when I talk about plant-based hospital food, people always have some very specific questions and specific situations that they ask about. For example, what about GI patients, right? They shouldn't be eating too much fiber. It could exacerbate problems. Isn't this diet high in carbohydrates? Could that be bad for people with diabetes? Patients in the hospital are sick, so they should be given familiar food that they've already been eating. And what about a renal diet? Can you have a plant-based diet fit into a renal diet? And then, oh my gosh, where are they going to get their protein? I know some of us have heard that one a whole lot. So these are all really valid questions. When we say that hospitals should offer plant-based options, it's not a mandate that every patient in the hospital should consume only vegan meals regardless of their situation. But don't hospitals have an obligation to always offer the healthiest food as the primary option if they're really going to be a place of healing? So before I get into the therapeutic diets and how a plant-based diet can meet those guidelines, I just want to point out that for every patient who's on a low fiber, potassium restricted, low sodium, or a high protein diet, there's also a patient on a plain old regular diet. And we can start there. The regular diet means there's no restrictions, and it's really a perfect opportunity for that patient to try something new and healthier. This is where we start. And then another obvious choice is the cardiac diet. So I know a lot of you might be familiar with that classic story where a patient is recovering from open heart surgery. And while they're recovering, they're offered a meal. And what is that meal? Maybe it's a cheeseburger. This is the same food that got them into that situation in the first place. Okay, but maybe it's a turkey burger and they leave off the cheese. That's a good start. So typically, a cardiac diet is going to focus on reducing sodium, reducing fat, and cholesterol. So this is a really good start, but we could actually do better. In addition to restricting those nutrients of concern, patients should be offered high fiber meals because research is showing us that fiber reduces cholesterol, can fight inflammation, it can help manage blood pressure. Fiber is beneficial for atherosclerosis, and just overall coronary heart disease risk will go down as you increase fiber. In the hospital setting, a cardiac diet might allow for lean pork and beef, or replace red meats with poultry. But for most people, this is not actually enough to manage the disease, especially not to reverse it. Red and processed meats should ultimately be avoided because they're high in saturated fat and cholesterol. They have some harmful compounds like heme iron, nitrites, and heterocyclic amines. In fact, the American Medical Association has called on all US hospitals to completely eliminate processed meats from their menu. This is both for patients, for staff, and for visitors. And this actually includes turkey bacon and chicken sausage. So those are just a few considerations we should take into account when we're building a cardiac diet, along with those typical orders, reducing fat, sodium, and cholesterol. And for the purposes of this presentation, I'm using diet orders from Adventist Health Howard Memorial Hospital, but diet orders at other facilities, of course, could be a little bit different. So here's an example of a plant-based cardiac menu. For breakfast, we have oatmeal pancakes with blueberries, maple syrup, a veggie sausage, and some fruit salad. For lunch, we could have a vegan mac and cheese with broccoli and a granola bar. Dinner could be quinoa, cranberry, and tofu salad alongside a chickpea curry. And we're even gonna include a dessert here. How about some carrot cake? So this brings us to about 1,900 milligrams of sodium, 44 grams of fat, and just under 1,900 calories. But this meal is also totally free of cholesterol and it's high in fiber. So next, let's talk about diabetes. Typically in the hospital, a diet order for diabetes is going to focus on carbohydrates. So it could be a low carb diet, it could be a standard carb diet, or maybe a high carbohydrate diet. The standard carbohydrate diet is the most common from my experience. And the reason there's such a focus on carbohydrates is because blood sugar control in the hospital is super important. The goal is to keep sugars less than 180, and this is going to help with wound healing and recovery. And managing carbohydrates is just a quick and easy way to meet this goal. Medications are also key, with insulin being the go-to in the clinical setting. But we do have to consider comorbidities like heart disease and kidney disease. Ideally, we can prescribe these patients a diet that's good for their blood sugar, but also good for their whole body. Now, the problem with only considering carbohydrates is that we miss the role that fat plays in diabetes. So we've known for years now, as you increase dietary fat, insulin sensitivity goes down, and this ultimately leads to type 2 diabetes. And then on the flip side, when you follow a low-fat plant-based diet, insulin sensitivity improves and blood sugar improves. Diabetes is highly influenced by food choices. So shouldn't we be setting up our patients for long-term success with their diet order rather than just focusing on those carb counts? With this approach, blood sugar might rise initially for some people, but this can be managed by insulin in the hospital setting. What's really more important is that the patient learns and sees examples on their tray in front of them of a meal that can really address the root cause of diabetes and any other comorbidities that they might have. But let's be realistic. So some hospitals might not be willing to completely change the diabetes diet order. So can we fit this plant-based meal pattern into a traditional diet order? So we're going to be using the standard carb order with a goal of about 60 to 70 grams of carbohydrate per meal for this menu. For breakfast, we could have a chorizo tofu scramble with sweet potato hash, some blueberries, and some soy milk. Lunch could be portobello fajitas, a Southwest chopped salad, and then we'll have a snack with some carrots and hummus. And dinner could be a vegan meatloaf with mashed potatoes, gravy, maybe some broccoli, and a side salad. So this brings us to 206 grams of carbohydrate and 1,561 calories for that day. This might be a little low for some people. If blood sugar is well controlled, maybe they could be ordered for a higher carb count. But the staff should also be trained to assess the quality of the carbohydrate, not just the quantity. So for example, if a patient's ordering a meal and it's made up mostly of complex carbohydrates like beans, they should be allowed to go a little bit over that carbohydrate limit. And these nuances should really be emphasized in the staff training and education. So next, I want to talk about the low fiber diet. Now, for healthy people, fiber is your best friend. It is essential for long-term health. But there are some instances where the GI tract is compromised, and you do need a low fiber diet temporarily to allow the gut to heal. Examples would include IBD, IBS, bowel resections, bowel cancer, patients with a colostomy or ileostomy, radiation of the GI tract, or flare-up of diverticulitis. A little bit more about this low fiber diet. The goal here might be like 8 to 11 grams of fiber per day, but there is more than just that fiber count, right? We want to focus on smaller meals to help with digestion, and fiber is actually better tolerated if it's already soft and broken down. So we can serve things like fruits and vegetables that are really well cooked, or maybe they're already blended, like a smoothie or a blended soup. And we do want to limit those spicy and fatty foods as well. And then since the diet can be pretty restrictive, it's important to make sure that fluid needs, or micronutrient needs, protein needs are all met on this diet. But the very last thing that we want is for this patient to think that the diet is good for their long-term health. It's a temporary diet, it's for bowel rest. In the long run, a high fiber diet is just essential for preventing recurrence of whatever condition that they are managing. So the patient should receive education on a slow transition when they're ready to a higher fiber diet. And this should also be in their discharge instructions. Okay, so can we make a low fiber diet work on plant-based foods? It's going to be a little bit tricky, but it's actually manageable. For breakfast, we have grits and toast with apple juice, vegan chocolate pudding for a snack. Lunch could be barbecue tofu with white rice and some Gatorade to meet those electrolyte and fluid needs. Maybe a light dinner, cashew butter sandwich with jelly on white bread, and then a bedtime snack of vegan yogurt. So the total here is around 10 grams of fiber. Remember, our goal was 8 to 11. You might notice there's no fruits or vegetables on this day, but absolutely, if the patient's tolerating it, they could have some really well-cooked vegetables, maybe blended soup or a smoothie to get those fruits and veggies up for the day. Okay, next, we have a high protein and a high calorie diet. This is ordered for malnutrition. And the patients might suffer from malnutrition for a whole variety of reasons. It's not necessarily diet related, but it could be related to the environment or a disease process, and it's important to address the root cause. For example, cancer, liver disease, pressure ulcers, burns, they could all lead to higher calorie and protein needs. And then especially for those elderly patients, just loneliness or dementia might be reducing their appetite. Many doctors might just look at serum albumin, which is not actually an accurate measure of malnutrition. Instead, a registered dietitian can do a much more thorough assessment. So a physical evaluation and a consult with an RD should definitely be ordered before any malnutrition diagnosis or a high protein, high calorie diet is ordered. So once we address the root cause for that malnutrition, here are some weight gain strategies that can help. So if a patient has a poor appetite, we can focus on liquid calories, smaller but more frequent meals and snacks. Protein supplements can be very helpful in some cases, and then those higher calorie foods like nuts and nut butter and avocado. And then if possible, a little bit of light exercise can really help to stimulate the appetite. And in these cases, we really do want to be offering foods that the patient is familiar with. So let's take a minute and just think about these comfort foods, because everyone loves a good pasta dish like mac and cheese, or how about mashed potatoes? These meals can be plant-based by default, meaning anyone who orders them gets the plant-based version. Hot chocolate, tomato soup, for example, these can easily be made plant-based with using non-dairy milk. Also, hospitals tend to serve a lot of jello and puddings, so we can have options like a vegan chocolate pudding, Italian ice, or vegan yogurt for those softer diets. These swaps are actually really simple and easy, and they do fit into a lot of different diet orders. Okay, so here's what we have for those patients who have higher protein and calorie needs. Granola with fruit and orange juice for breakfast, maybe a mid-morning snack, a vegan ice cream cup, a vegan mac and cheese with quinoa cranberry tofu salad. So this vegan mac and cheese is made with silken tofu, which is why this meal gets us a whopping 43 grams of protein. And by the way, a lot of these recipes, including this mac and cheese, are available on our webpage, which is healthyhospitalprogram.org. And Chef Dustin is going to talk more about that shortly. And then a protein supplement might be helpful in this case. We have Kate Farms, which provides 20 grams of pea protein in just 11 fluid ounces. It is plant-based, and it actually tastes pretty good compared to a lot of other protein supplements. We could have pad thai for dinner and a hot chocolate with soy milk for dessert. So we have 2,700 calories and 103 grams of protein. This is actually, it could be a little bit high for some people, but you get the idea. And then before we move on, I just wanted to highlight a few options for plant-based oral supplements. A lot of hospitals rely heavily on nutrition supplements. These often contain a lot of dairy protein or corn syrup, but there are healthier plant-based replacements, both in the pre-mixed and in powder form, as you're seeing here. A plant-based protein powder could be added into, say, a house-made smoothie, and this is really great for patients on a full liquid diet. Say they're transitioning from clear liquids to solid foods. And then many large hospital systems are actually contracting with Kate Farms, and they offer plant-based tube feeding formulas for a lot of different dietary needs. These are easily sourced for almost any hospital. Okay, next, renal diets. So as our renal function declines, the body is less effective at clearing out certain compounds. So we worry about things like phosphorus and potassium. You definitely want to keep sodium low to manage blood pressure. And sometimes these patients might be on a protein restriction. So we want to keep phosphorus under about 100 milligrams a day. And where do we find phosphorus in the diet? So phosphorus, it's in animal products, it's in processed foods. It's also in nuts and seeds and whole grains, but it's actually poorly absorbed from plant sources. That processing really increases that phosphorus bioavailability. In one study, patients actually shifted to a diet that became 70% from plant protein, and this was found to be just as effective on urine phosphorus excretion as putting the patient on a phosphorus binding medication. And then potassium. So plant-based diets tend to be high in potassium, and patients with renal disease are told to limit potassium. But again, the most readily absorbed sources will come from processed foods, from preservatives, from animal products. Potassium absorption is highly regulated, but it's better regulated when fiber is involved. The body could increase absorption if needed, and some high fiber foods can actually hinder absorption to less than 60%. Research is showing that in patients with chronic kidney disease, a plant-based diet is not linked to elevated serum potassium levels. In fact, a plant-based diet is really beneficial for kidney health, and especially for patients with kidney disease. And here's why. Avoiding animal protein reduces the workload on the kidneys, and then reducing saturated fat can improve blood viscosity, which then reduces the workload on the kidneys. Of course, fruits and vegetables are protective for almost everything. And studies on patients with chronic kidney disease show that they might have a reduced need for medication, they might have reduced complications, and just an overall better outlook on their disease progression and survival. So here's what a renal diet might look like in the hospital. We're limiting phosphorus, potassium, and sodium, and we're going to have just slightly lower than average protein requirements. So like any renal diet, it's going to take some planning to fit these guidelines, but it's definitely possible. Breakfast could be cream of wheat with cranberries. We could have a roasted vegetable sandwich for lunch. A snack might be pretzels with mustard. And then dinner, maybe lentil soup with a bagel and strawberry jam. Okay, so the last diet order I want to talk about is the high fiber diet. So this should ideally be ordered for any patient coming out of surgery, especially an elective surgery, because it's going to help with bowel movements after anesthesia. But then eating more fiber makes you have to eat more plants, which then really helps manage comorbidities if they have any, and it'll increase the patient's micronutrient and antioxidant intake. So by eating a plant-based diet, you naturally get more of the nutrients that you need for healing. So in the hospital, we focus on vitamin C, zinc, and protein specifically for healing, but also phytonutrients and bioflavonoids are sometimes overlooked, but they are equally important, and you get more of those when you're following a high fiber, a plant-based diet. So here's what that menu could look like. So we're going to have adequate calories, protein, fiber, vitamin C, and even zinc here. So we've got oatmeal with orange juice for breakfast. Lunch might be a 3-bean chili with cornbread and broccoli. A snack might be hummus with bread and then a pear. For dinner, we could have lasagna with a cashew, tofu, ricotta, and a side salad. Okay, so let's summarize. First and foremost, plant-based meals should be offered as the primary menu item for patient populations that are just the least restricted. So what is that going to be? We've got the regular diet, the cardiac diet, a consistent carbohydrate diet, which is ordered for diabetes, and a post-op diet. There are a few diet orders that are going to require a little bit more planning and education. For example, a renal diet, a low fiber diet, or a high protein and calorie diet. And then what diet order is it just not possible to make work on a plant-based diet? Well, pretty much none of them. So let's remember that being in the hospital is a crucial time for patients. They might be rethinking their lifestyle choices, making plans to avoid having to come back to the hospital. In the words of the American College of Cardiology, hospitalization is a teachable moment. So hospitals should really be ready to set examples and to follow up with education and resources on how nutrition can impact a patient's health. Speaking of resources, you can visit pcrm.org/factsheets to find patient handouts, recipes, and in-depth information on starting a plant-based diet for your patients. We've got detailed research-based fact sheets on over 30 topics. Many of these are also available in Spanish and in other languages. And send all your patients home with their own cookbook. This patient cookbook features colorful, nutritious, and simple recipes that can help anyone to get started on a healthier path after being in the hospital. So I want to encourage you all, if you have any connections to a healthcare facility, speak with the Food and Nutrition Services Department about making these changes, and we want to start wherever is easiest. Next, we have a short video to share, and then Chef Dustin Harder is going to continue the presentation. He's going to talk about how you can make these changes at your local hospital. Thank you.
I think it's important for hospitals to offer plant-based options because when you think about it, many people are hospitalized for complications of conditions for which nutrition has a really powerful underlying role.
As a dietitian of over 20 years, it means so much to me to be able to offer these delicious, nutritious, plant-based dishes to our patients and really elevate their experience within the hospital.
What a beautiful thing it is. We have not a lot of restaurants in town that are serving farm-to-table vegetarian, vegan options. But here at Howard, we're doing it. Coming out of a hospital, I don't know, it's amazing. It's beautiful.
Oh, I think it's wonderful to have a hospital in the community that offers plant-based because it is a hospital. And you'd like to think that if people are being healed here, that's part of it is the nutrition.
There are so many foods that I tried that I was shocked at how good it tasted and it was plant-based. I started really, feeling better as I was eating the way I should have been eating.
Offering plant-based options here at the hospital means not only do I have an opportunity to serve really delicious, healthy, fresh food, but I also have the means to educate people on why eating these plant-forward dishes is really good for health and also the environment.
As a registered dietitian, it means the absolute world to be able to offer plant-based options on the menu on a daily basis to patients. Every patient that we meet with, we're talking about the power of plants, and when we're catching patients in this moment in the hospital when they're vulnerable, their body's trying to heal, to be able to offer them the food that we know is going to work best is just wonderful.
As a dietitian, it's my job to educate patients and the public about the healthiest ways to eat. And research is showing that having your diet be a foundation of plants reduces your risk for diseases. Heart disease, cancer, even depression. So as providers in a hospital, we have the unique position of feeding people who are seeking medical treatment the healthiest options, practicing what we preach.
Well, hello, I'm so happy to be here today to talk to you about creating a healthier plate for patients in hospitals. My name is Dustin Harder. I'm the culinary specialist with the Physicians Committee, and we have meetings all year long talking with a variety of people when it comes to hospital food. Anyone from doctors and nurses to dietitians to patients and also family members of patients. And often when we talk to the family members of patients, we learn just how disappointing their recent stay was for their loved one at a hospital. And they always have that big question, the question of how, right? How can we get more plant-based dishes on hospital menus? How can I make sure that my father, who just had a heart attack, isn't served a cheeseburger and fries when he's in recovery? And I wish I had one simple answer to this big question, the question of how, right? But the truth is it's nuanced. And it's nuanced because getting plant-based options on a hospital menu can be a long process because it requires change. And we all know there's resistance to change because change can feel scary. And it's also important that this can't be just any plant-based option, right? The items that go on these menus have to be healing, healthy foods that are nutrient dense, but they're also delicious, right? And they have to be delicious so that the option stays on the menu then. So the good news is that there are actually already hospitals creating change for the better, one bite at a time. There's even a fully plant-based hospital. The world's first completely plant-based hospital exists in Beirut. In 2021, Hayek Hospital went 100% plant-based. And I wanted to mention this today because it certainly serves as inspiration and hope for the rest of us as to what is possible, right? And in an article about the shift to plants, Hayek Hospital had this to say: our patients will no longer wake up from surgery to be greeted with ham, cheese, milk, and eggs, the very food that may have contributed to their health problems in the first place. We believe it's well about time to tackle the root cause of diseases and pandemics, not just symptoms, for our health, for our planet. So I want to share some items with you today that can help when making efforts to get more plant-based options on an institution's menu. We have a website we've created called healthyhospitalprogram.org. So on this site, you're going to find tools and resources you can share with your local hospital in an effort to be part of the solution. So there's a lot of pushback when it comes to communicating plant-based options to hospitals. Some of the biggest obstacles you're bound to face are education. So educating the staff and culinary training costs, not just the cost of ingredients, but staffing cost, labor cost, guest satisfaction and patient satisfaction, the misperception of a plant-based diet. Everyone just loves to say it's terrible, even if they haven't tried it yet. And then just plain and simple resistance to change that I already mentioned. Now, because of that resistance to change, we found that often the best approach is baby steps. So this can be hard. You find yourself excited about plant-based options and the health benefits, and then you're defeated when it doesn't all happen at once at your hospital. But you have to realize that even one plant-based offering being added to the menu is progress. And if it's delicious, and if people order it again and again, and if the staff loves it and they tell patients about it enthusiastically, then a second option might get added to the menu. See, it's often about planting the seed with institutions. Planting the seed, watering it over time, and then you just gotta let it grow. We want to give you the seeds to plant to be the support system you need to water the seeds over time so they can grow and flourish. So at healthyhospitalprogram.org, we share the tools and resources we've gathered from hospitals that are already implementing plant-based options. So you've got the QR code here, but don't worry, we're going to put the link in the chat. It's going to go out in the email, so you'll have access to this. This website exists in an effort to motivate and inspire other hospitals. Now, we've learned one of the most important puzzle pieces on the crusade to get plant-based options on the patient menu is to have an ally. So an ally is defined as someone who is on your side, like a more experienced teammate, who's your ally in convincing the coach to give you more time to play, or maybe it's that coworker convincing a boss to give you a raise, or in this case, the ally is convincing decision makers to say yes to plants. Now, decision makers in this arena might be department directors, managers, hospital administrators, CEOs, And in this setting, an ally might look like a culinary lead or executive chef or kitchen manager. It could be a nurse or a physician or a dietitian. It could even be someone who's in charge of the health and wellness programs at the hospital, or it could be a patient. Now, a patient is often given the opportunity to give a survey when they leave the hospital, and patients should always take this opportunity to talk about their experience, good or bad. If the experience was good, you want to tell that hospital it was great, tell them what they did great, tell them they gave you healthful, delicious options on the menu so that they keep delivering those options. And if the experience was bad and there weren't any good options on the menu, you want to tell them that was unacceptable. Now, an ally can be anyone, really. Anyone who's willing to be persistent and also show up and follow up and shower those decision makers with kindness, with persistence and kindness being the key words here. We recently strategized at Emory Hospital in Emory University Hospital in Atlanta, but it took the perseverance and dedication of Christina Morgan, who's the director of EmWell. So that's their wellness program at Emory University in healthcare. And we started things out slowly with a tasting in 2022 and came back in 2023 to strategize with the Emory Culinary team for a 20-day plant-based pilot. And the results were positive, with an 83% satisfaction rate via survey diners took in the cafeteria. Furthermore, 9 days out of the 20, the plant-based options outsold the meat and dairy options by almost double. So this is fantastic progress. Now, Emory has moved on to the next phase, implementing more plant-based options at their various cafeterias and making strides to transfer those popular cafeteria options over to the patient menu, because that's the end goal, right? Options like this vegetable masala dish, you can find this recipe at healthyhospitalprogram.org. Now, when we started with Emory, we supplied the culinary team with recipes, a customer survey. We helped curate raffle prizes for the diners as an incentive to take the survey. We offered them a timeline with milestones and goals so they kept everything on track and kept moving along. We curated a press release and we initiated marketing assets that were available for them to use as needed for digital menu boards, staff newsletters, and social media, anything like that. Now, the key component here in gaining future buy-in from decision makers is collecting data and sharing it with them. So one of the ways we collected data, or they collected data at Emory, was with a QR code. So this QR code went on everything. The containers for the food, the digital menu board went out in a staff email so that everyone had an opportunity to fill out the survey. They also collected data from their sales so they could see what was selling at the end of the day. And that's how they figured out they outsold the meat and dairy options on those days. Now, thanks to allies like Christina, continuing to collaborate with the culinary team in various departments at Emory, she's keeping that needle moving forward and she's getting decisions made. Another success story is Parkview Medical Center in Fort Wayne, Indiana. But there's more than one success story, I'm happy to report. There's so many. And at Ally Parkview Medical Center, their ally was Andrew Lockwood, who was then the director of food service. And we have Dr. Monica Agarwal at the University of Florida Health. And then we've got Chef Robert Garrickton. He's at St. Luke's Hospital in Lehigh, Pennsylvania. Now, these people just cared about the betterment of their patients they served, and they were persistent in seeing change. There's Jocelyn Dubin. She's the lead public health nutritionist at Santa Clara County Public Health Department. Thanks to her persistence and kindness and dedication, 2 hospitals in Santa Clara now feature allergen-friendly plant-based recipes on their menus. And then we have Annie Ersley, a registered dietitian at Adventist Health Howard Memorial, who worked with her team tirelessly to create new meals and implement education for her staff and her patients to thrive. Now, the list goes on, and for some of these places, they have just scratched the surface. They've planted the seed, and now they keep watering it over time and shifting and changing to meet these institutions where they're at and to help them grow. So now I ask you, are you the ally? Are you the person who's going to speak up at your local hospital and start pushing the needle in that plant-based direction? If it is you, I invite you to explore healthyhospitalprogram.org. So at this website, you'll have those resources and tools that can help you navigate when connecting with decision makers. I mentioned that biggest question is always how, right? Well, the bottom line is that the culinary team has to make the food and they have to make it delicious. You can get everyone on board, but if the culinary team doesn't believe in it and the dishes aren't tasty, that ship will sink pretty quickly. So cost is always a big sticking point with culinary. You might have to persuade the culinary lead that the cost of a plant-based diet is comparable, if not less, than their traditional offerings. At NYC Health and Hospital, where they now offer plant-based options at all 11 of their hospitals, they've saved 59 cents per tray. And at St. Luke's in Pennsylvania, they have the opportunity of saving on an average of about 55 cents per serving. All this to say it is possible that it helps to show up with information to support your position. Now you can get a more detailed look into NYC Health and Hospitals, costing and practical application in a new article that was just published in the American Journal of Lifestyle Medicine. So back at healthyhospitalprogram.org, under the resources tab, you will find a fact sheet on eliminating processed meats. This fact sheet explains the health risk associated with consuming processed meats. And then right next to it, it offers simple solutions for your hospital. There's also a Healthy Hospital Program toolkit that offers a new approach to nutrition for healthcare settings, tips to adhering new laws and policies, meal ideas for major contractors, testimonials from leading hospitals, and links to recipes. We also have that fantastic patient recipe book that Dr. Herbie mentioned. So many patients these days are being told, oh, you need to try a plant-based diet, go vegan, try more plant-forward, eat more vegetables. And a patient says, okay, great, but how? This book is a very simple, effective, and free answer to that. All of the recipes have nutritional analysis on them, and it even includes, because not everyone likes to cook, it even includes a convenience section in the back. So these are accessible ingredients that can just be tossed together to make a simple plant-based meal. So you can request copies of the patient recipe book for you and for your institution to hand out to patients for free. There's also a link for an ebook of it, so you can send it out digitally as well. Back at healthyhospitalprogram.org, we've also compiled easy-to-follow menu ideas for your institution featuring breakfast, lunch, and dinner options. There's also a one sheet that offers easy plant-based swaps for meats, eggs, cream, milk, cheese, and items of the like. On our education tab, you will find resources that will allow you to share the power of nutrition for health with your healthcare associates. We have the education page set up with direct links to Nutrition CME, where physicians, physician assistants, nurses, nurse practitioners, and dietitians can earn free continuing education credits. There's information on leading an educational session for your colleagues, the community, or patients by offering a class by one of our fabulously trained Food for Life instructors. Now, getting one of these instructors in your facility it's one of the best moves you can make. Our instructors are passionate and they all have a story about their own path to health and wellness. Sharing their personal stories paired with the education is exactly what resonates and can jumpstart someone or an entire institution on deciding to make a healthful, long-lasting, impactful change. Please take advantage of our Food for Life instructors in your area. You can find an instructor at fflclasses.org. Back on the website, we offer tips on hosting a film screening, something like Forks Over Knives, or conducting an in-service, maybe to watch last year's American Hospital Association's Healthy Hospital Food webinar. We also offer the opportunity to partner with us on employee wellness, coordinating an employee plant-based challenge or a lunch and learn. The Physicians Committee is available to customize programs to motivate your staff. We want to help you put these tools in action. As a matter of fact, when you go to the homepage, you will see a header that says, how is your hospital doing? And a button that says, share feedback. We want to know if your hospital is thriving or if it needs help. And then we want to connect with you so we can help strategize next steps. Or if your hospital is thriving, we want to shout it from the rooftops and share your leadership with the world to motivate other hospitals. Also this year, we added a new page called Healthy Hospitals on Demand. This features videos of a video coverage of hospitals that are stepping up to the plant-based plate and leading the way in offering plant-based options on their menus. These videos are great because it's of different hospitals implementing plant-based options. And this is not a one-size-fits-all. So this shows other hospital maybe bits and pieces they can take from different hospitals that will work in their hospital. And now, my favorite part, says the chef. Back on the website, we've got a bunch of recipes for you too. We have a recipe page with plant-based recipes that have been gathered from various hospitals in an effort to streamline the recipe search for culinary teams. The recipes are available for the home cook and also scaled up in volume and weight measurements so they can be effectively put to use in any institution kitchen. So, let's say you have your hospital on board. What would next steps look like in using these tools and resources? Well, you could do a tasting. Do a tasting for your staff, gather feedback, implement the most popular items on your cafeteria menu. Once you get the items on the cafeteria menu, do a survey with raffle prizes as motivation. And once you have a popular cafeteria menu item, you can start to make waves to move it over to that patient menu, that big end goal, right? You can work with the culinary team right away to create easy swaps, right? Perhaps it's a marinara sauce instead of a meat sauce on pasta, or maybe they serve an instant mashed potato. Let's get them to serve a plant-based instant mashed potato. It's important to meet your institution where they're at, to plant the seed. And once you have any plant-based options on the menu, you want to spread the word. Let everyone know about the new plant-based options with social media engagement, table tents, digital menu boards, digital ads on patient TVs, and signage posted around hospitals advertising the availability of plant-based options. And when options are being offered to patients, you want to make it the primary option. You want to make it the primary option so that patients know it's the first thing you say to them, and they know they have the freedom of choice to choose the healthier option. Make plants the primary option, the first one mentioned. Don't let that new, delicious, tasty, life-saving option get buried at the end of the list. And this next one here is a big one because time is hard for everyone, right? But education is crucial. You have to educate the staff at the hospital. Take time to really share talking points with your nurses, dietitians, and food service associates. Hype them up about the new delicious items. Make sure they try the items and have discussions about the health benefits associated with the new menu items. This will empower them to enthusiastically offer plant-based options to their patients. And lastly, get creative. Think outside of the box. Every hospital is different with their own unique challenges. Together, we know we can find the right fit to make inroads and implement recipes on patient trays that are abundant with healthful, delicious food that will heal them and keep them from returning to the hospital. So, are you the voice of change? Go to healthyhospitalprogram.org and let us know how your hospital is doing and how we can help you. We're looking forward to finding the right path for you and helping your team strategize for an effective outcome. And of course, we wanted to give you a look today at some of the recipes that are offered at healthyhospitalprogram.org so you can see what the possibilities are for yourself. The recipes I'm about to share with you are all currently available and being served at various hospitals already. They're available for free right now to you and any institution to use at healthyhospitalprogram.org. So these are just a few examples of what you might consider using to conduct a tasting at your institution. We've got this delicious and hearty black bean quinoa patty. This is from Adventist Health Howard Memorial. And we have this vegetable pasta primavera bursting with nutrient-dense vegetables, hearty pasta, and a robust sauce from University of Florida Health. And then we've got the quinoa, cranberry, and tofu salad, so refreshing, from the George Washington University Hospital. Southwest chopped salad loaded with the goods from St. Luke's University Health Network. And then there's these roasted vegetable and hummus wraps. This one's the easiest one. Every hospital could master this one. This is from MedStar Health. And this is the chickpea, potato, and coconut curry. Luscious, creamy, decadent, delicious. If I were a patient and this showed up at my bedside, I would be thrilled. This is from University of Florida Health as well. Then we have the wonderful tofu vegetable pad thai with all those familiar flavors that you love from NYC Health and Hospitals. They also gave us this protein-rich, hearty 3-bean chili, and we're not leaving you hanging. We've got desserts on the website too. What about a vegan rice pudding or a vegan carrot cake from Adventist Health Howard Memorial? Now, here's the thing about these recipes. It's just delicious food. It's just delicious food that happens to be full of healing, healthful ingredients. Isn't that what hospitals should be serving? As healthcare systems become more aware of the health benefits of plant-based nutrition for patients, hospital menus are evolving to offer more plant-based options on patient trays. But the change is sometimes hard-earned, and we can't do it without your help. When you're looking over the recipes and resources at healthyhospitalprogram.org, think of what it must feel like for a patient who is recovering in a hospital. A traumatic experience in itself. The one thing they might have to look forward to is the meal they're being served. The meal should nourish, it should heal, it should be delicious. And we believe all of those things are possible and that change is possible. We hope you will join us on the crusade to offer the Healthy Hospital Program resources far and wide, putting patient care first, not just for our health, not just for our planet, but simply put, because it's the right thing to do. Thank you for having us today.
Thank you so much, Dustin and Anna. I hope everyone is feeling motivated. I can see in the chat that several people are. Great resources, really leaving us all with actionable next steps, and a great website to check out with the Healthy Hospital Program website. So thank you so much. And I really appreciated your slides for food as medicine through the plant-based diet, and then those sample menus. And then Dustin, just thank you all for those actual next steps and those hospital examples. And this is why we do this over lunch. I get it now. Um, I want to do a call out to Stephanie McBurnett, who's a registered dietitian with PCRM, who is taking many of your questions through the chat. I'm just looking here, and I believe, Stephanie, thank you. You've answered every question that came about, whether in the chat or in the Q&A, and we had a lot of great ones. I just want to pause to see if there's any final question. We have time for maybe one question before we end today's call, but truly fantastic information. I just see people thanking you all and feeling very motivated. Perfect. All right. Well, I know that Stephanie has shared several of the links to the websites, YouTube links, video links. They are all in the chat for you all to access. I think, Dustin, I think we have several allies on the call, and several people that are excited and motivated to make change. So brilliant presentation. I agree. And someone said it earlier, it's a no-brainer, right? It feels like a no-brainer. And thank you all for bringing these ideas and these examples to the AHA audience, and hopefully making our hospitals a place of healing for all. All right. We have the links in the chat. Oh, we can't wait for a taste test. Perfect. Anna, Dustin, thank you so much for your time today. Wonderful information, and excited to see and hear what the hospitals are doing. Please share with that Healthy Hospital Program website to hear how you all are making change. And after today's webinar, you all will be receiving an evaluation link. So please just take a few moments. That really helps to get your feedback. And PCRM, thank you so much for your time today. A true pleasure.
Thank you so
Thank you,
much.
Amy. Thank you so much for having us.
Wonderful. And the email with links will go out on Monday. Thank you, Stephanie. All right. Thank you to all of our participants for joining. And this will conclude today's webinar.